On today's Wellness Report, a warning for Americans as the so-called super flu surges across the country, with New York City now reporting its highest flu levels in more than a decade. Health officials say cases are climbing rapidly. Doctors warning the worst may be ahead.
Hospitals and urgent care centers across New York City, they are seeing a sharp increase in flu patients, driven by aggressive and fast-spreading flu variants now circulating nationwide.
And some doctors are also raising concerns about the effectiveness of this year's flu shot, noting that newer strains may not be a perfect match for the vaccine, potentially reducing how well it prevents the infection, even though it still may lessen severe illness.
Medical experts stress that while the flu shot remains an important tool, it's not a guarantee, especially as the virus continues to evolve. Combined with holiday travel, packed classrooms, and winter weather, the conditions, they are ripe for continued spread.
Health officials say the flu season has not yet peaked, urging folks stay alert to symptoms and take common sense precautions. Wash your hands.
Okay, yeah, that's one.
It is. Yes. It's one of the big ones.
Okay, joining us now to weigh in is the administrator for the Centers for Medicaid and Medicare Services, Dr. Mehmet Oz. Doc, it's a pleasure to have you on. Good to see you on American Agenda.
Always honored to be with you. By the way, coughing into the crook of your elbow also works.
There you go.
Sensical. There have never been randomized trials on these tips, but they do work.
Yeah, okay. They're teaching that in preschools now.
There we go. Good. Let's stop the spread there. So talk about the super flu. I guess it's going around here. You know, it can be deadly. We know that. So what's going on here?
Well, flu is always a problem. Every year there's a flu vaccine. It doesn't always work very well. That's why it's been controversial of late. But like many illnesses, the best news out there is if you can take care of yourself so that when you do end up running into the flu, you can overwhelm it as much as it's trying to overwhelm you, you do better. So things like getting sunlight, and if you can't do that in northern parts of the country, which is tough this time of year, take some vitamin D. Zinc seems to be effective as a basic supplement. But fundamentally, the MAHA initiatives, eat the right food that came out of the ground looking the way it looks when you eat it and consume it, and getting physical activity actually makes sense. But the most important tool of all is sleep. It is the main way we generate growth hormone, gets our immune system psyched up. So if you can get your sleep in this time of year, which can be tough because during the holiday season, folks go to work, they go party, they have fun with their families, they deal with all the mishigash that surrounds all those three issues, and they get worn down, it tends to set you up for a bad flu.
It's the mishigash that gets you, huh? The Centers for Medicare and Medicaid Services announced that all 50 states will be receiving awards under the Rural Health Transformation Program, a $50 billion initiative established under President Trump's Working Families Tax Cuts legislation aimed at strengthening, modernizing health care in rural communities across the country. That's something that's really been necessary, needed.
Essential to the well-being of our nation. We all have to have a fair chance at health. Unfortunately, in America, your zip code determines your life expectancy, and rural America has fallen further and further behind. The president has made the largest commitment ever with this $50 billion investment in rural health care. It's a 50% increase in the total money that Medicaid spends on rural health care. And why do we need this money? It's not to pay the bills. We need to actually right-size the system. We need to fundamentally restructure how we offer care in rural parts of this nation. There are at least 60 million Americans that we're talking about who just don't get access to the kinds of things we take for granted in more urban and cosmopolitan areas. But the big news here is we're getting the states to compete. We're getting the states to all go after this kitty of money with the best ideas they have and break down the barriers that have held back access to health. For example, telemedicine. Why do we have restrictions on it? If you can get doctors from the big city to talk to folks in rural parts of the state, why not make it easy? Why not make it easier to recruit nurses and doctors, or just get pharmacists to perform at the highest level of their licensure? Because we have politics to get in the way. If you have money on the line, the politics tend to melt away. And we're empowering governors with this money to go out there and change the future of their people. The first tranche just got mailed out. Imagine getting a $200 million check this time of year. It's a nice gift, but the gift has strings attached. And we'll give you that money every year for the next 5 years, as long as you do the things you promised to do for the president and Congress.
Yeah, key word there.